First, we can stop Ebola. We know how to do it. It will be a long and hard fight, and the situation in Lagos, Nigeria is particularly concerning, but we can stop Ebola. Second, we have to stop it at the source in Africa. That's the only way to get control. And third, that we have to stop it at the source through tried and true means. We do know how to stop Ebola. Meticulous case finding, isolation, and contact tracing and management. We, with our partners, have been able to stop every Ebola outbreak to date, and I'm confident that if we do what works, we will stop this one also. But it won't be quick, and it won't be easy. It requires meticulous attention to detail, because if you leave behind even a single burning ember, it's like a forest fire, it flares back up. One patient not isolated, one patient not diagnosed, one healthcare worker not protected, one contact not traced. Each of those lapses can result in another chain of transmission and another flare of the outbreak.
If there was any one thing that needed to demonstrate a lack of attention of the international community on this crisis, which has now become an epidemic, it was the fact that the international community was comfortable in allowing 2 relief agencies to provide all of the clinical care for the Ebola victims in 3 countries. 2 relief agencies. Samaritan's Purse and Doctors Without Borders. It was not until July the 26th when Kent Brandley and Nancy Wright-Bowl were confirmed positive that the world sat up and paid attention.
There is no way to count all the people dying of Ebola in the villages and in the remote areas. The cause of death is often unknown, and there exists a lot of suspicion toward Western and government health workers. As a result, information is often withheld from health workers. Advice on safe burial practices or abstaining from eating bats and monkeys is oftentimes met with resistance and even violence against health workers.